You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome back to the third episode of the three-part series from the Pharmacy Podcast Network's coverage of the APhA 2025 Annual Conference and Exhibition. Key takeaways of this year's APhA included the value of professional networking, the importance of patient-centered care, and the ongoing need for pharmacists to stay engaged, inspired, and committed to their profession's highest standards. The conference ultimately served as a reminder of the pharmacy profession's potential to make a meaningful impact on patient health and healthcare delivery. And now, here's our host, Todd Urey, with an interview with Alex Berg, the Vice President of Operations with RX for Root.
Alex Berg here at the APhA 2025 talking about RX to go. Alex, welcome to the show.
How you doing, Todd? Pleasure having you here, and thank you so much for having me on this show. It's been great so far for everybody over here. Just wanted to touch base a little bit on RX to go. In one of the previous episodes, I believe Donnie, one of my colleagues, already had a chance to talk a little bit about that. So just in short, RX to go is more of a typical courier company in a sense where we fully take care of all delivery operations for the pharmacy. So instead of having any separate in-house drivers and taking care of the logistics, we fully take care of that, because one of the first things I always tell to the pharmacy is that they should aim on the healthcare. Mm-hmm. Logistics is something that is so separate that they should not be focusing on that and only having the patients happy and healthy most and foremost. So with RX to go, we are currently rapidly expanding. We are in 7 different states. We are in we have a heavy presence on the East Coast. Okay. That will go for New York, Connecticut, Jersey, Mass, PA. We just opened a recently location in Florida, in Miami area, and we are about to open up a Tampa location as well, and we'll have a location in California.
When I think of RX to go, I immediately think of our community pharmacist, our independent community pharmacist. However, I'm also thinking of long-term care pharmacies too.
Correct.
So talk to me about the sectors that you're working in.
So we don't have any specifications on like that. We are only working retail or LTCs. We work with anyone who will need some help with deliveries. So we do have some retail pharmacies. We have specialty, compounding, long-term care. We even help with some DME deliveries for some long-term care pharmacies as well as big healthcare establishments. For example, one of the big names that we currently work with down in New York would be NYU Hospital, Mount Sinai, for example. So big hospitals are also part of the chain, as well as, for example, MSK Cancer Center that we also just recently signed up in New York. So there's no specifications on to home delivered to. We're capable of handling all of that.
Very good. Okay, and when you said specialty, I started thinking of temperature-controlled medications that need to be cold or they need to be a certain temperature. Are you tied into those types of deliveries?
Yeah, absolutely. So for temperature-controlled medications, that's something we handle as well. We do take care of regular fridge medications that would require immediate refrigeration by us. We also can take care of the freezer medications and cooler boxes. So for fridge items, we do have all of our drivers are equipped with the cooler and ice packs and those. So whenever the driver goes into the pharmacy to pick up the packages, they have all the equipment needed to keep it cold. As soon as we're going to receive it in our facility, everything is equipped with the stationary fridges as well. And when the driver goes out to the route, we also give them new cooler, new ice pack, and they go out to deliver it nice and cold. Everything is controlled. We have a monitoring system in place that checks temperature for all the facilities, for all the freezers and fridge that we have in the facilities, so we always make sure we keep that on point. For cooler box medications, it really depends on the specifications of the pharmacy, because some of them have it stable for 36 hours, some of them 48, so it really depends on a specific client. Okay. But those we do not keep refrigerated, because those usually pre-packed in a styrofoam box with the ice packs, so we just take them, deliver as it is.
All right, let's talk tech. So the technology that you have out there, I'm thinking of the GPS indicators, I'm thinking about data reporting, I'm thinking about APIs to a pharmacy management system. Talk to us about that. Talk to us about that side of it.
Sounds good. Yeah, that's a good question, because that tech we've been building, it's I'll be honest, it's amazing. The reason for that is because it's been building in-house for the past 10 years, and there's never been any investors or someone who we need to go and report back to. So it's fully in-house built tech that we've been, developing for the past 10 years. So to begin, for example, as an API, like you just said, we are working and we are integrated with a lot of and most of the major PMS systems. Okay. That will go for Primarex, Best, Liberty, Epic, you name it. So most of them that are most popular, we are currently integrated, and it's a really nice two-way integration, which means pharmacy does not have to spend time on creating orders manually. They don't need to even worry about human error when they input the orders, because they just simply tag the prescriptions on their PMS system. It goes to our platform, and it's a two-way integration, which means the signatures and any other delivery proofs will be immediately in real time sent back to their PMS system. We also have an open API, like you said, so which means if the pharmacy comes up to us and says, hey, we have this software, but we're not currently working with it, we're going to make it happen in a month. Excellent. I have a really good IT team.
Excellent.
So we're going to make that happen. For GPS, for example, we also do collect a lot of data for the pharmacy to review. That goes for logging every single action that happened with an order, which means they can go and see timestamps for every single point of time for that medication, where we picked it up, when the driver delivered it, when he was on the way to the patient. Everything is logged, including text messages and phone calls that our dispatcher exchanged with the patient as well. So pharmacists have full visibility on what's going on there, including the GPS location as well.
Let's talk about ROI, because your team and your management group, when I was talking to Donnie before in the pre-show, we were talking about ROI, and return on investment of something is pretty important to independent community pharmacy owners that really want to know, so how is this going to help me stabilize and thrive? So what's the indicators of when is it time to use RX to go versus trying to do this on my own?
So I would say it would go down to just convenience and the technology we provide. And I always say that, like, we are definitely not the cheapest on the market, right? There's definitely solutions that would be cheaper to go for the pharmacy, but they will not find better than us, right? The way that we structured it, and the way of the technology and the whole, I would say ecosystem that we have in place, that is something that they would not be able to replace to just by their own, or even with some competitors of ours that we have, just because, we're just, especially on the East Coast, for example, we have such a big network of our own in-house drivers that, we have a pharmacy in Connecticut that don't want to ship in Pennsylvania. We got them covered. And it's going to be next day delivery, barely a little bit more expensive than they would just send something locally there. So I would say that would be mainly the convenience for the pharmacy, and just, peace of mind when they send out the delivery, they know it will go from the point A, which is their pharmacy, to the point B, which is the end patient, with no hiccups in between. Because as I've been talking to a lot of our clients who came from USPS and carriers, it's not the best experience with them, right? They barely get any tracking. They don't get no notifications. There's a lot of hiccups when the package just simply goes missing and they say, whoops, we don't know what happened. Yeah. With us, that's not something that will ever happen, because there's just so many different tech in place with the quality controls that we have that, it's pretty much impossible for the package, just go a wrong way or something. For example, just to quickly make a point on our quality control team, and that's something we're really proud of, is our QA/QC team. Because a lot of our, even competitors, they might have some tech in place to prevent some wrong deliveries and everything. And besides just the actual tech, we also have a physical quality control. Okay. Because we have a team of good 40 dispatchers on our quality control team that verify every single aspect of a delivery in real time. So the driver went ahead and they delivered an item, it appears on their screen, and they verify every single thing. Hey, did we deliver to the right building? Did we rent to the right apartment? Did we take a signature? Every single aspect of delivery gets checked by a real person. We're not even letting it to do it for the AI or stuff like that. It's real people who's making sure. So just by doing that, we reduce it to up to like 99.9% of correct deliveries.
What's the average delivery time? Are you doing deliveries the same day? Are you doing deliveries more in a 24-hour period?
So we do have different types of services that we provide to the pharmacy. Of course, it will be, different price range for those. Yep. But the basic one would be what we call a regular overnight delivery. So that when we pick up the package from the pharmacy today, and we will deliver that tomorrow. Overnight, we have a big team of around route planners that work in each facility, so they are responsible for all what I call backstage magic overnight, because they're going to be preparing all the packages, make routes for the driver, and make sure that in the morning when they go out, we got everything ready and they can just pick up their packages, go out to deliver them. So the regular items are delivered the next day anywhere from 8 o'clock in the morning till 9 p.m. at the evening, and the patients are, as I mentioned before, getting throughout communication. They got text messages in the morning with the exact time when they expect the delivery. They got live tracking link, and they got real dispatchers calling them to let them know when the delivery is coming. Now, we also have a same-day option. That's where we're going to pick up from the pharmacy the same day and deliver it the same day before 9 p.m. They have time window option for the next day, where the pharmacy can pre-select specific window when they would like to have the patient that medication. And they can choose 9 to 1, 1 to 5, or 5 to 9. Or if they really want to, we can also go with the custom time windows for them as well. Last but not least will be stat deliveries. So that is an emergency medication. If they call in and they need it now, they create it, and our system right away makes a notification for our separate stat team that sees, okay, this emergency medication has been just created, and we send the first available driver to the pharmacy to pick that up. They get it, and they go directly to the patient with no extra stops. And if it's within the 3-hour driving distance, we guarantee it will be delivered within 3 hours of them creating that order. I don't think anybody does that time frames.
So you might have just answered my next question, and that is the expansion of pharmacy deserts is a public health threat. And when I think of deserts that are out there where people have to drive 5 miles, 20 miles, 50 miles,
Exactly.
60 miles to get to a pharmacy, I think of Rx to Go as a way of extending the reach of a community pharmacy.
Absolutely.
So what's if I drew a circle around a pharmacy that was using Rx to Go, how big is that circle?
So it would really depend on the area where they're located. If we're talking about some new states, for example, like Florida, where we're expanding, it will be not as big. It will be probably like maybe a good 30, 40 miles right now.
Okay.
But if we're talking about the states where we're good established right now, as I mentioned before, we might have a pharmacy in Connecticut, and we can give them access to ship anywhere where we have locations on the East Coast right now, because what we did and what we are currently expanding on as well is connecting each of those locations. That's why we can accomplish such things as a pharmacy in Connecticut giving us a package that they would like to get delivered somewhere in Pennsylvania. We receive it in our facility. Overnight, we got people who's going to transport that package from Connecticut hub to our Pennsylvania hub, which means in the morning we send it out locally with the driver and they can deliver there. So it's just a matter of time and matter of our expansion. But as we take East Coast as an example, you know, they're not limited to even their own state right now. They're limited just with those East Coast locations and hubs we have there. So they have good like 200-300 mile radius right now, maybe even more, depending on where they're sending.
All right, so I'm a pharmacist, I'm a pharmacy operator, I own a pharmacy, even I'm a small hospital system. How do I get a hold of you in order to get like a proposal and really learn more about Rx to Go?
They can go to rx2go.ai. That's our website. We have most of the information available there. We have our contact information, our emails, so they can right away go ahead and see everything they need to know and reach out to us right away. And we have really good sales team that will get in touch with them right away, get them custom proposal, make sure we cover everything they need. And the best part that we do that not a lot of our competitors does, we really tailor our system and the proposal we give them directly for their needs, because every pharmacy is unique. They have different needs. They have some nuances that, you know, some other companies might overlook. We're not like those. We're really client oriented. So we'll make sure we take care of them the way they deserve.
This is great. All right, Rx to Go. Alex, it was great talking to you.
Awesome. Todd, it was a pleasure. Thank you so much for having me here. Thank you.
We'd like to thank our press coverage sponsor, PharmaStaff. The pharmacy industry is changing. One of the most expensive aspects of your business is payroll. With all the challenges you're experiencing running a pharmacy business, have you thought about reducing the cost of your staff by up to 75%? PharmaStaff provides outsourcing positions to handle patient customer support, prior authorizations, incoming calls, update databases, and any other tasks you require. At PharmaStaff, your health information is secure and exceeds in compliance standards by implementing even stricter safeguards to protect your data's integrity and confidentiality. Schedule an appointment today with PharmaStaff and learn how your pharmacy operations can scale your key administrative positions inside your pharmacy at a fraction of the cost. Contact PharmaStaff today by visiting their website. Go to pharmastaff.com. That's PharmaStaff.com. Let them know you learned about these incredible people resources from the Pharmacy Podcast Network.
We are here at APHA 2025. I'm here with Laura Harding from INMAR.
That's right.
All right, so talk to me about INMAR. Let's tell the listeners a little bit about what this platform is all about.
Okay, sure. So INMAR we help pharmacies optimize the healthcare value chain to improve patient safety, access, and affordability. And when you think about INMAR, it's really more about the business side, not the clinical side.
Okay.
So we're helping pharmacies recover revenue through the revenue cycle management process, or even through the supply chain, through reverse logistics, and a variety of other solutions that we provide that help to make them more efficient and help them to be smarter about the revenue and cost lines in their business.
Every time I see INMAR, your booth is constantly filled up with people at the NACDS Total Store Expo. Everybody was there that was, around and that's what brought my curiosity, because I love technology. I love platforms that help our pharmacies be more efficient. What's important about being here at the APHA? What's been your observation of our gathering this year?
Well, it's been really fun. There's a lot of students here, and I've enjoyed engaging with the students because they don't learn a lot about the business side of pharmacy and pharmacy school. It's very clinical. And so it's been interesting as we're engaging, and you said you see us a lot, and our booth is always full, and that's because, and I'll say to the students, well, it's great that you've come to talk with us, because when you start practicing pharmacy, you'll be working with us, because we pretty much work with everyone. And, sometimes it's not the obvious things, but it's these business processes that are going to help to make their pharmacy safer or more money. And so we'll talk through it with them. And a lot of them who've done a residency are like, oh, yeah, I've worked with your technology, in the pharmacy. So they really start to understand it. But, the thing, I really loved what Michael Hogue had to say in yesterday's opening session about how our payment system is badly broken. And that we've got to change the way we get paid, and pharmacists need to be paid on the medical benefit, not just the pharmacy benefit. And I think that's really it's so true. And because we're on the business side of pharmacy, trying to help them really optimize the way that they make money, that resonates with us. And the other thing that I love that he said was, we sit beneath the shade of trees we did not plant. And it's one of his favorite quotes. And the thing that I loved about it and took away from it was, it's also time for this new student generation to plant new trees.
Exactly.
Because we're at an inflection point, and the business side of pharmacy has to change. And we're seeing that with all the things that are going on. PBM reform and all of these other things. And so I'm hoping this generation of students is really inspired to think differently and be change makers.
Absolutely, and I like that, because the students, once again, aren't getting exposed to the business side of pharmacy. So being able to be here and ask questions and start putting the pieces of their puzzle together and where they want to go. Where do they want to go in community? Do they want to go in research? Do they want to go and write new algorithms and AI to advance some kind of disease state research or management? So INMAR, I'm seeing you show up at specialty pharmacy conferences like NASP and Assembia. I see you here at the APHA. Obviously, we just saw you at the NACDS Total Store Expo. Does INMAR have workflow and business management for each of the sectors, or is it the same platform that the whatever pharmacist type or pharmacy type, they're just kind of filling in the blanks for themselves?
I would say that, we do curate it for the segment. Certainly, hospital pharmacies operate differently than retail pharmacies. And we do have a lot of technology in the hospital space that's unique to what they're doing. Like, for example, the crash cart has 200 meds on it. Every time it gets used, it's got to come back to the pharmacy. So, you can wave the INMAR iPhone over it, and it'll tell you what's missing, what's out of place, what's recalled, what's expired. So it's an efficiency solution that's really just geared towards what's happening in the hospital environment. So, and specialty has its own unique needs as well, but we really work with every kind of pharmacy: hospital, specialty, long-term care, independent retail. All the big chains are our customers.
I want to say thank you for stopping by the booth and taking time to talk with us at the APhA Post Show, and I hope to have you guys back. I want to do a series with INMAR.
Yeah, that would be great. And we were even talking to APhA about coming back next year and actually doing a session about the business of pharmacy, because that, I think, would add value to this.
Very much so. Thank you, Lari.
Thank you.
The Vice President of Pharmacy Services and Clinical Programs, Kelli Stovall with Independent Pharmacy Cooperative, better known as IPC, shares how their digital health platform iCare Plus is revolutionizing chronic care management.
Independent Pharmacy Cooperative, IPC, Kelli Stovall is here with me at the APhA 2025. Kelli, it's so good to see you.
It's great to see you, Todd. So glad to be here.
Now, how many times have you been to Nashville?
How many times I've been to Nashville? Well, I only live about an hour and a half from Nashville, so we come quite often.
Like, not even a big deal.
We love it. We
great.
love the city. So.
All right, so let's talk community pharmacy. Let's talk the importance of the evolution of technology fused with treatment. And the very first thing I think of is iCare Plus. And you go around to different conferences really engaging and talking with pharmacy operators and owners about the importance of digital health in the future. But talk to me about some of the clinical programs that could be made examples of using the iCare Plus system.
I think what's really exciting right now is we are in pilot phase with our remote patient monitoring remote patient monitoring program of iCare Plus. It's a tool that's already built into the program, and it allows stores, pharmacies, pharmacists to be that healthcare provider and monitor patients with chronic conditions like hypertension. And we have stores in pilot phase right now that are doing remote patient monitoring programs with hypertension.
It's incredible. So I think of other disease states that we could be adding on to this portfolio, and then being able to go to those patients who already know our community pharmacies, and now we're saying, hey, we're going to be able to do remote therapy monitoring for this, 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 and this. So what's the future map look like for iCare Plus? Are there specific disease states that you've honed in on?
So with remote patient monitoring, we're really looking at hypertension, we're looking at congestive heart failure, COPD, chronic obstructive pulmonary disorder, because we have devices that are Bluetooth and cellular enabled for blood pressure monitors, pulse oximeters, and weight scales. From a remote therapeutic monitoring, which you mentioned, we can look at weight loss programs. We have scales, obviously, that can be used for that. And chronic care management is also something that can be brought in and used. We can use our tool for that as well.
How are we, it's so important to get the message out that this technology is available through the community pharmacy. So how are we educating the market? How are we educating the community that this is available?
As far as the pharmacy community or the patients?
The community pharmacies to the patients.
To the patients. So we actually, we have marketing programs with iCare Plus that are business to business and business to consumer.
Okay.
So we do market out to our stores on the possibilities. We also do a lot of education. I think one of the big hurdles with remote patient monitoring is not everyone knows what it is. Not everyone knows how to set it up. First you need a collaborative practice agreement with a provider or a health system in your area. How do you approach that provider? How do you suggest they identify those patients? And then set that up, that relationship. You've really got to start that relationship. That's really step one. Then you've got to train your staff and on how to manage that program within the store. And so we work with our stores on that, and so they're ready. And then we also offer consumer marketing too that drives patients in. So
very good. All right. So APhA, what have you noticed? What have you been interested in at this year's American Pharmacist Association? Is there a theme here that you've been interested in?
APhA is just always great. as a pharmacist, it's always really been that benchmark conference where you refuel on your clinical knowledge. And thankfully, IPC has allowed us and the pharmacy services team really to be here and refuel that clinical knowledge so we can help our members, continue to help our members. And I would say there's a lot of clinical program and clinical services.
Yep.
Underserved, helping patients that are underserved, that seems to be a theme in a lot of the continuing education as well.
Isn't it fun to come to a conference that you don't have a booth, that you don't have to man, that you just get to be a participant?
We were talking about that last night. It is so good to be an attendee and be able to actually
relax.
And attend all of the meetings and really feel like you're getting a lot of what you miss when you're actually an exhibitor.
The APHA is perfect for that because I've never seen this as a super intense business conference as it is a networking and advocacy and educational conference. So having the pharmacists show up and consume all of the programs, I think that's a huge advantage.
And it's fantastic just to be with all of your peers.
Absolutely.
And network and exchange ideas.
If you want more information on iCare Plus, please go to ipcrx.com. Once again, that's ipcrx.com, and there is a whole section that's dedicated to iCare Plus. And let them know that you found us on the Pharmacy Podcast Network.
Thanks, Todd.
Time for our last pop quiz. Oh, don't be sad. You can always rewind and pretend you didn't hear it yet. Who invented penicillin? His initials are AF. Think hard. You got this. Okay, time's up. The correct answer is Alexander Fleming. I know you got that one right. Right?
Hey, at the APHA 2025, I'm walking through a booth, and all of a sudden it says, "It takes two." And it was very prominent, and it had TV screens up, almost like old-fashioned televisions. And I met Jim, and you're here with me now at the Pharmacy Podcast Network. Jim, introduce yourself to our listeners and tell us about your colleague and talk to me about this campaign.
Great, thanks, Todd. Jim Hunsinger from Boehringer Ingelheim on our Value and Access organization, and I'm here with Stephanie Delman. She's on our pharmacy space, and we're excited to be here to talk about It Takes Two.
Tennessee is a wonderful state. Nashville, so much fun. Stephanie, how has your interaction with pharmacists been here at the APHA?
Honestly, wonderful. Students are interested in learning more about what It Takes Two means and what we're trying to accomplish. We've had some really great results at the booth.
Excellent. Jim, talk to us about this important campaign because we've done podcasting on CKD before and how important chronic kidney disease information for pharmacists is. So I'm excited about this campaign. Talk to our listeners.
Yeah, Todd, It Takes Two is an unbranded health initiative that aims to elevate the importance of early diagnosis and treatment of chronic kidney disease. It's all about two tests, eGFR and UACR. And for patients, it's them and their doctor, and really aiming to increase screening, diagnosis of CKD and appropriate treatment.
So why use the UACR test? Why have you chosen that test?
So it takes two tests to get the full picture about chronic kidney disease. Your patients with type 2 diabetes and hypertension may have early stage CKD without even knowing it, and the eGFR testing only tells half the story. A study by LabCorp and the National Kidney Foundation showed that less than 20% of patients at risk of CKD between 2013 and 2019 received complete testing, which is defined as both eGFR and UACR. One test is not enough to screen patients for CKD. Following clinical guidelines from diabetes and kidney organizations and using two tests, UACR and eGFR.
Talk to me about the prevalence of CKD. Has that been something that has, over the years, now it's being found more in people? Is it a rising concern, a rising disease? Talk to us about the prevalence of CKD.
It's rising significantly, and the Center for Medicaid Services claims analysis shows that 70% or more Medicare Advantage patients who have a lab value indicating CKD do not have corresponding CKD diagnosis, underscoring the importance of diagnosis for following eGFR and UACR testing to ensure appropriate treatment.
Stephanie, how do pharmacists play into the CKD care management planning. And when I think of physicians get to see their patients, but pharmacists are seeing them 9 times more per year. So how important is pharmacist in the realm of CKD treatment?
We depend on pharmacists to be that last touch point with the patient, and really to remind them that they should be asking their doctor to include a UACR test, whether they have diabetes and or hypertension, to ensure that they do get that full picture of chronic kidney disease.
That's wonderful. And what a place to be here at the APHA, where we have so many different mixtures of pharmacists who are concentrating on health system, specialty, community, long-term care, and geriatrics. Is there one demographic that you're seeing a rise in CKD over something else? Is there a time in our lives where humans are like, okay, this between the ages of 44 and 65, or like what's the demographic that's really being honed in on?
Well, it's definitely in middle age and older, but it's really type 2 diabetes and hypertension are usually the key indicators for patients with chronic kidney disease. It's important for the appropriate patients to get the right testing, and that's the EGFR and the UACR.
Excellent. We want to do more with you and your team. Hopefully you'll be able to return back to the podcast, and let's build out some additional education support for pharmacists who are driving in their cars or taking a walk and just want to listen to something to bring them up to date with CKD treatment.
Awesome. Thanks, Todd.
Thank you for being part of the show.
All right,
Happy
take
to
care.
be here. Thank you.
APHA in Nashville 2025. I'm here with Dr. Brandon Welch. So good to see you.
Great to see you, Todd. I know it's been a few years, man, since we last seen each other.
Down south in Florida, where your home base is we caught up, and I think it might have been at NSU. Might have been one of the networking events or something there.
Yeah, we even saw each other at I think it was NCPA a few years back too, when it was in Orlando.
So tell the listeners, just in case they don't know who Brandon Welch is, if you're in pharmacy, I'm not sure that you wouldn't know, but nonetheless, just in case, talk to them about your mission and what you're doing in sports pharmacy.
Yeah, and so my primary role is I work with Baptist Health South Florida. So I am their clinical sports wellness pharmacist, where I help, support our sports medicine clinic, whether that be your typical patient that comes in with osteoarthritis, and I'm trying to get them some good acute care pain management. And then also I help support or run the Sports Pharmacy Network, where we are a team of clinical pharmacists, and we also have our sports dietitian, Sean, where our mission is really to help create this interdisciplinary practice model where a sports pharmacist can really utilize their clinical expertise to help advance the care and support of our athletes, right? And so whether that be through pain management, so we know that athletes get acute and chronic pain management injuries, supplement safety, making sure that they're taking the appropriate supplements that have the right efficacy, they're safe, they're not on the banned substance list, and then also, making sure that they're staying healthy, whether that's through blood biomarker testing and making sure that none of our athletes, for example, are female athletes who sometimes may be at a higher risk for iron deficiency, right? Making sure that their iron levels are at the appropriate range, and then trying to protect them from, not getting any type of acute illnesses. So whether that be, acute colds, flus, and making sure we're recommending the right pharmacotherapy management. But I mean, you're seeing this emergence of clinical sports pharmacists and really being able to display and showcase their true clinical value to help athletes perform at the top of their game.
Brandon, who's telling the stories from the NCAA's perspective or even the pro football's perspective that, hey, you're missing out if you don't have a pharmacist kind of part of this team, working with the dietitian, working with the trainers, giving reports back to the coaching staff? Like, talk to us about how we get the word out.
The main thing's going to really have to be education. For example, a lot of us at the Sports Pharmacy Network, we speak at a lot of national and regional athletic training association conferences on a variety of different topics that are in our domain or that are in our wheelhouse, right? And the other thing is kind of what we talked about earlier is implementation, right? And so we need that level of advocacy, seeing who are those head honchos and those key stakeholders and decision makers in the NCAA the NFL or any of these sports institutions to help really, showcase why they need a clinical sports pharmacist. And it's a very big mission of the Sports Pharmacy Network.
So Baptist seems to be ahead of the game, where they've invested in and have accepted and embraced sports pharmacy. That's another thing. Are there other health systems out there that you're starting to educate and saying, hey, don't pass on this. This is a big deal.
It's coming. I have the poster board that I'm presenting today between 1 and 3 at APHA in the poster session hall, where we did a survey, right? So we evaluated the perception of a clinical sports pharmacist in a sports medicine clinic. And we utilized, the sports medicine physicians, athletic trainers, sports dietitians, whoever's part of that healthcare team to see what's their true perception of a clinical sports pharmacist. And Todd, we had nothing but perfect feedback with a little bit of nuance here and there, but that's fine, right? Because we can take that as constructive feedback and continue to improve and sharpen our sword. And so it starts with one institution, which is Baptist, who's trailblazing the way. Yep. And then now it's, okay, how do we adopt this into other health systems? Like Memorial's not too far from us, right? I could see them easily adopting something like this. We have USC, right? While that's a university over in California, I think their clinical sports pharmacist, Michael Kessler, and their dean, Carrie, they're doing some amazing things. And, to see this implemented in a variety of clinical settings, whether that be in a health system or a school institution, is pretty inspiring.
It is. Hey, we want to thank you for being part of the APHA 2025 Post Show. We'd love to follow up with you and get more of the sports pharmacist stories, because it's the stories that are going to help other pharmacists realize, wow, I'm interested in this. Let me get involved.
Absolutely. Always good talking to you, Todd. And make sure you guys follow Sports Pharmacy Network. We are on LinkedIn, Instagram, and we're also on Twitter.
Excellent. Thank you, Brandon.
You got it.
Catherine Duggan from the FIP, the Federation of International Pharmacists. Welcome to the APHA 2025.
Hello, thank you so much for having me.
It's good to see you again. Tell me, what focus do you have here at the APHA, FIP, the international presence of pharmacy, and you're here in Nashville?
Yeah, well, there's, I suppose, 3 different elements that you can look at. Firstly, it's really to ensure people have an opportunity to be part of our global community, to be part of the 4 million pharmacists, pharmaceutical scientists, and pharmacy educators that we represent in FIP through our member organisations, but also to make sure that we understand a little bit more about the challenges and the opportunities facing pharmacists across America in different spheres of practice, understanding the needs of our member organisation like APHA, but also this Congress pulls together lots of the organisations who are part of our membership at FIP as well. So it's an opportunity to network, to keep in touch, make new friends, and to encourage people to be part of the global community as much as they are their US community.
Where will the FIP big event be this year?
Copenhagen. And we're really excited to have it in Copenhagen. We just closed the call for abstracts on Monday past, the 17th of March, and usually we get, on a good year, 950, 1,000 abstracts submitted. We've had 1,500.
Oh my goodness,
and
that's
the spread
great.
of countries is amazing, so I think we're just building on the success that was Cape Town last year. Copenhagen this year, Montreal next year.
That's incredible.
So we're going closer to the Americas next year, so hopefully people, if they can't make Copenhagen, can come to Montreal.
When I think of pharmacists over the years, I always think of the word safety. So what type of things does the FIP focus on from a safety perspective to notify pharmacists of what's happening out there, whether that's a recall or whether that's like something that may be happening regionally, maybe an epidemic of some sort. But what kind of things are FIP focusing on for safety?
So we have got 21 development goals that are aligned to the Sustainable Development Goals from the UN, and we have a particular one on patient safety. And safety to pharmacy is in our DNA, and whether that's about how to formulate a medicine, how to manufacture a medicine, how to ensure the safe supply of that medicine, storage of that medicine. Then there's the issue around access to medicines, to ensure that they are accessible and equitable in the way that we supply them. And I also think safety about how that medicine might interact with the individual if they have comorbidities, but also how the medicines might interact with other medicines they're taking. Then we have got some really big global issues around the standards of medicines when they are manufactured, and the whole side hustle of substandard and falsified medicines, which are present in all of our markets.
Right.
And when you see this happening in countries, you've got to be able to share and showcase different types of solutions. So that's really important to us. But then you've also got this idea about the monitoring of the medicine. So the safety profile of that medicine, their usage, the ethics of it, the availability, the costs, for example. So in fact, like many of our goals, that one thing about patient safety is impacted by all of the elements of medication, manufacture, all the way through to medicine's use and adherence, and then all the data, the pharmacovigilance, the pharmacoeconomics, the pharmacoepidemiology of the medicines in society. Yeah.
Catherine, people that are listening to the show here in the United States based, how do they work with the FIP? If they're listening, if they're part of a state association, if they're part of another one of the national associations, what's the best way to reach out and to work with the FIP?
So you can work with FIP through the member organisation, so they become almost like your vehicle. We work with each member organisation to see how they would like us to share materials, so we can work with that organisation and provide particular access to particular resources that their members may need. But we also have an individual membership category as well, so people can join FIP. They can join a section which describes where you're working, so hospital, community, industry, military and emergency, pharmacy, to name a couple. But we've also got, I mentioned the development goals, we've got 21 development goals that have issues as diverse as academic capacity all the way through to sustainability, access, safety, AMR, we just spoke a minute ago on safety. So if you've got a particular burning issue that you'd like to get engaged with, or you'd like to know what your colleagues in different countries are facing, then you can get involved in our hub. We have an observatory which gathers all the data from the countries. We also have very many digital events that are free to access, so people can see, I'd like to showcase my expertise, or I'd just like to get involved so I can become an expert over the years. Mentorship, leadership development, courses, all sorts of routes in to the FIP, and you can always find out more about us on our website, which is www.fip.org.
FIP.org. Catherine, it's always been a pleasure talking with you and getting an update from the FIP. We enjoy talking with you, and we hope to have you back very soon.
Looking forward to it.
Thank
and
you.
Hope to see you in Copenhagen.
Yes. Marsha, it's so good to see you. We've been in each other's networks for years. I never get to interview you as much as I'd like, and I think that you are filled with so much wisdom of what's taking place in our profession and where we're going. It's so good to see you.
It is great to see you, Todd. I think I remember having a conversation with you. I want to say it might have even been at this meeting 5 years ago before the pandemic. And it was great talking to you about your entrepreneurship with the Pharmacy Podcast Network. And it's fabulous. You're here on the show floor doing podcasts live with a lot of really innovative people. So I'm delighted to be talking to you today.
Thank you. You do a lot of writing. I'm a big reader of your content. You talk about innovation a lot. You talk about how the industry is moving forward. And I think that and as much as I love our younger pharmacists and people that are helping to bring new light to our industry, it takes people that understand where we were to really tell us all where we're going. And I know that might sound cliche, but it's true. So talk to me about innovation from your perspective in the profession of pharmacy.
I appreciate that, and I have to say the APHA meeting is probably my go-to meeting for that. So this is, I don't want to date myself, but this is my 42nd APHA, so I've only missed 3 since 1980. And it is my go-to because of, again, the innovation. I just mentioned you being on the show floor. This is very, very innovative. One of our pharmacy students has an entrepreneurial business over in the Digital Health Center. I mean, he's competing with huge industry databases, and it's working for him with his Pearls company. And I just love that sense of spirit, and I can do anything. And I think that's really been one of the themes at this meeting. One of the first people I ran into was an innovator in clinical services that I had in one of my books 22 years ago. And she's still innovating. She's the vice president of clinical services for a major pharmacy chain in the United States. So I find inspiration and innovation at this meeting everywhere I look.
A lot of that inspiration comes from organizations like Pearls that are very entrepreneurial. So innovation and entrepreneurship go hand in hand. So talk to us about the entrepreneurial spirit of the pharmacy profession.
Yeah, I mean, I think it's not any better reflected than what I heard this morning in the general session as our new president, Randy Medunga, came on stage and talked about believing in yourself, his 5 tenets of going out there and doing it. And, you know, he was at this meeting, someone challenged him, hey, you say we should be out there innovating and being paid for services. And, you know, it's easy for you to say it. It's different when you have skin in the game and you've got your money invested. And he went out and he partnered in the ownership of a pharmacy that now has, I think, nine or more locations where they're providing excellent patient care. So I think that's really it. You can't be afraid. Often the question I ask myself when I chose to become self-employed is, you know, what is the worst thing that can happen to me? And as long as you have a backup plan for that, you're good to go.
So Randy is special to us this year. Not that he's not a special person to our profession, obviously he is, but his cohorts, his associates, voted him 50 most influential people in pharmacy for our awards. It's our 4th time doing the awards, and his name came up, and I'm still tracking him. He's so busy to be able to get him on to bring into an interview and bring his insights in.
Yeah.
What is happening from your perspective in the role of the pharmacist, shifting from the massive amount of dispensing that they were doing to now being much more clinical and much more treatment driven and much more treatment management like?
Yeah, I do see it every day. I still practice casual relief pharmacy for a company based in Minnesota, and so I still get out there about 10 to 20 hours a week. And one of the things we're really getting into, and it's based on patient demand, which I think is great, we're doing a lot of patient point of care testing. So literally last week I was working at the pharmacy. Husband came in on a Sunday with his 5-year-old child. Her brother had strep throat. They needed to be tested, and it was luckily, you know, the patient was negative. We're doing a lot of that kind of service in the pharmacy. We're more convenient than any other healthcare provider, and honestly, we're getting paid for our services without needing to go through insurance companies, and people are willing to pay for that service. So I think there's more and more opportunity. Yesterday, I took the opportunity to go through the poster sessions, and I am amazed at the bright minds that I talked to there and how many posters there were. Sometimes I forget to do that when I'm at this meeting, but yesterday I did. And I took pictures of probably 6 to 10 posters that were on innovative topics that I had not seen addressed before. So I was really excited about that. There was a professor from Ohio State that's teaching children. They have a partnership with the Science Museum of Ohio based in Columbus, and he's teaching children what pharmacists are through gaming that he has created. It was phenomenal. There was another resident who had done a poster on misinformation that female patients were getting off TikTok about hormonal contraception that I thought was so unique, and I had never seen that before. There was another person who had been looking at Board of Pharmacy and where do pharmacy disciplinary actions, how do we compare to other health professions, which I thought was interesting, and I'd never seen an analysis before. So just, again, a lot of opportunity to do really different, fun things that advance the profession and patient care.
Marsha, I've been waiting for this interview. I appreciate you spending time with us. You have to promise to come back on This Week in Pharmacy.
I would love to, Todd. Thank you for the opportunity.
Thank you. Blair Thielemier here in Nashville at the APhA 2025. It's so good to see you.
Good to see you again.
All right, so what's new in your life? A lot of changes have taken place. We were, right before we started recording, we were talking about the Elevate Summit that was the very first virtual summit for pharmacists that you put out in 2017.
It was.
So, I mean, a lot has changed since then. But what's been on your mind lately in how it's impacting our profession?
So for the past 10 years, I've been talking about medical billing and opportunities for pharmacists to leverage their clinical skills and be paid for them. What's really exciting is we're actually seeing that come to fruition right now. So, the state of Arkansas made pharmacists a provider 2 years ago, and going through the process to get credentialed, I wanted to really understand from the very beginning what that process looked like to apply to be credentialed as a provider through Blue Cross Blue Shield, and to really have some use case scenarios that we can take to other pharmacists to say, see, this does make sense in your workflow. This is an opportunity to get paid for clinical services that aren't separate from what you're already doing in dispensing, but really leverage and accentuate the patient care that you're already offering.
Are you coaching pharmacists that want to expand this business for themselves? Are you working with a bigger organization? How are you getting this knowledge out and helping pharmacists?
So the Pharmapreneur Academy is still online. It is a 24/7 resource for pharmacists who really want to understand what are their opportunities in consulting on the 3 pharmapreneurial paths. So the physician's office, what would it look like to partner with a collaborative physician to be able to bill under their NPI, versus the pharmacy-based path, which would be getting your own NPI number, credentialing with an insurer, and being able to bill for a medical benefit. And then the third pathway would be more the cash-based services. So the ones that we're seeing, helping patients get tested for strep or flu or screening. So there's been so many innovative opportunities. And the Elevate Summit that you mentioned, we started back in 2017 before the pandemic, so before everybody was on Zoom. And that was really my way to help identify some leaders in pharmacy and to lift up others who were doing really cool things in this space. So I'm continuing to walk that path now that we really have a turnkey model for pharmacists. Now I'm helping those independent community pharmacies and individual pharmacists mostly to understand what their opportunities are in their state, to understand their payer mix and how to get credentialed with those payers, and then to put a workflow process in place so that you're leveraging your support staff members as well to do the information gathering and the triage so that you can still stay in that clinical space to really help the patient in that way.
Blair, we really appreciate you stopping by and giving us an update. I want to encourage our listeners, if you're interested in the Pharmapreneur Academy, Blair, tell us where we can go for more information.
Yeah, pharmapreneuracademy.com. We still put out a monthly newsletter with updates of how medical billing works, and we host retreats. So we've got another retreat coming up in Ecuador at the beginning of November. Anyone who's interested in that, please reach out to me. I would love to work with, especially, women who are looking to develop themselves into leaders and really putting their voice out there online and through social media in a new way as a pharmacist entrepreneur.
Love it. Dr. Blair Thielemier, thanks for being on the APhA 2025 Post Show.
Thank you so much for having me, Todd.